If you're a physical therapist and you think you're on the right track, but you're wondering what's next, there's got to be more, or you're bored in that same framework, you need to watch this video. My name is Dr. Garcia. I help sports physical therapists and cash-based physical therapists improve patient outcomes and patient satisfaction. Why is traditional PT boring? Let me explain what an insurance-based model and a cash-based model, even within both of these settings, why traditional PT is boring. Here's how it all starts. Somebody gets in pain. They Google something, they YouTube how to solve my knee pain. They try it for a couple of times. They can't solve it on their own. So then they think, what other things have my friends done to fix this knee? So they reach out to their friends, save a couple bucks, and instead they go to their primary care physician who says, rest it and do nothing for 2 weeks, take some ibuprofen, you'll be fine. They waste that time, they go back to their primary, get an x-ray, which was negative for anything. Primary says, you know what, you should try physical therapy. By that time, they're 8 to 12 weeks after initiating that knee pain. So much has gone during that time. Now, here's the cog wheel that you're caught up in. They now have to call for verification into your insurance-based clinic. That's going to take them a week or two to get authorization, come back in, your schedule, blah, blah, blah. We're now 13, 14 weeks outside of this whole system. They now enter your clinic. They say, you explain what physical therapy is. You're so proud. You think you're going to change your life. But the problem is you're limited to 15 minutes and you have 15 minutes of care, 15 minutes of Therex. Because of insurance, you have to bill so much to be profitable inside a clinic. So you have to bill 4 units, even though you don't feel it's absolutely necessary. So you feel unethical. And then that patient has to be on ice or modality. They go home and they repeat that for 12 visits. And you hope they get better, and you know that people get better. Their visits run out, and you say, see you later, I've discharged you. You no longer have to come back. And if you have any pain again, just come see us. Let me guess. That's probably the scenario in. Let me tell you that I have been able to escape that boring monotony for about 10 to 12 years now. I opened a cash-based physical therapy business, and I'm not saying that cash is everything, but I will say is the freedom and flexibility is what I want you to understand. And guess what? The APTA, the insurance-based companies, anything, the private practice section, no one's going to get you out of this except you and using this framework. Now, here's how a better scenario works. That same patient, that same person, that same customer had that same knee pain. They probably went to YouTube. Now, where you're going to stop and intercept is 2 ways. They avoid going to their primary care, or when they ask their friends, they say, I went to John's physical therapy, Maria's physical therapy. It was different. I think you need to give it a try. So they're going to go to your website, they're going to go to your Instagram, their YouTube, and look at how you're different. Now, here's why you're going to be different. They're going to call in, you're going to explain, great, why did you develop knee pain? Instead of saying, what's your insurance verification? What's your address? What's your date of birth? And blah, 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 the same structure that comes in. Now what you're going to do is you're going to take a different approach. Not only are you going to solve their knee pain, you're going to get them pain-free, but you're also going to explain, I don't feel right about getting you pain-free. I'm now going to make sure that this doesn't come back. So instead of the 6 visits it was going to take me to get you pain-free, I'm going to need you for 10 or 12 visits. And what this is going to do is the first 4 visits will get you out of pain. I'm very confident in that. I've been doing this for many years. That's what you're going to say. Then in the next 4 visits, we're going to work on strengthening, a 4-week block of strength and conditioning programming. By that time, you've built a little bit of neuromuscular control. You've built a little bit of strength. Now you're going to put them onto a injury prevention phase. And what you're going to do there is teach them all the fundamentals of everything you've dreamed about keeping people away from pain. But you never had that chance, never had that opportunity as an insurance-based provider or even as a cash-based, because you never saw it this way. You wanted it, but just didn't know how to deliver it. So instead of being a pain specialist, like the boring monotony warehouse factory style of an insurance-based facility, you're now going to take them through pain relief, strength and conditioning, injury prevention. And here's the beauty of the next phase. You're now going to be able to help them with more than all of those things, because all of those were musculoskeletal. But the great part is, for a fact, you've been to school for many, many years. You've been working for many, many years, and you know that people only know what they know. And what your guidance and your goal is to provide them with more information, more education on how to improve their active lifestyle. You know that they're going to need help with shoe fitting. You know they're going to need help with orthotics. You know they're going to need help with their diet. You know they're going to need help with strength conditioning. You know they're going to need help with posture. Even though they didn't come for that, you know you can conquer their knee pain. But what you also know is you can help them dramatically. You have to be able to share that with them. But there's 2 factors why physical therapists can't succeed in this type of a model, more of a healthcare provider model. Because 1, you don't have the skill to deliver on the strength and conditioning. Most sports PTs say that strength conditioning is purely an upgraded home exercise program. They add a couple reps, they add a couple tough, challenging things on a Bosu ball, on an RX, and they add a couple weights. That's pretty much what strength and conditioning is to a traditional ortho PT, rather than a structured process to get them strong and using 4-week blocks, so using a deload week and understanding incremental percentages. You need the clinical skill on that. Then you also need the clinical skill on injury prevention, using the right testing, using the right strategy. How many reps? How often do you need them? Looking at their warm-ups, looking at their cool-downs, being able to guide somebody through true injury prevention. That's one, is a clinical skill. But the second part is the communication, helping someone understand you have all those clinical skills. They all want them. The problem is that barrier to be able to do that. And ultimately, what you want to be able to take is a bird's eye view of somebody's health, their lifestyle, their active lifestyle, and be able to help them with those variables. I call them dials. So what you want to do is turn the dial on pain. You can shut that off real fast. Great, let's get you strong. Turn that up. Great, let's work on injury prevention. Great. Did you know that you're under recovering because you don't get enough sleep? You're under recovering with your nutrition. All those things are great conversations, but you're scared to have them because you don't want to be salesy. You don't know when to do them. And ultimately, you're just trying to understand, how do you help people in their life more than just being a pain specialist? It's boring, it's monotonous, and doing the same thing over and over again, rubbing a knee, mobilizing a shoulder. It's just day in, day out. And that's why you're bored. It's not that you've hit burnout. It's not that you are not good at your craft. It's that you're limited to one little wheel within the musculoskeletal or health profile. And one of the things that we can do is break free from that and become a healthcare provider, and not just a sports PT. So while you pride yourself on your initials and every CE you've taken, the question is, how far do you want to go in your career path? And one of the things that you can do is build beyond being a sports PT and into a healthcare provider. My goal is to introduce this to you and start to change the way you see this. So if you're stuck, start to work with your patients on beyond your knee pain and into health. Start asking, how often were you exercising before? Were you following any structured program? So you just used YouTube or Google to do that. Hey, did you know that I can help you? That transition sentence is so critical, and just offering next that explores that piece. And while you're doing the strength conditioning, have you ever tried preventing these injuries? Because it actually would be better for you, because I've seen you 4 times over the last 3 years. You had to work on 6 weeks of traditional care, or I could prevent all those. Would you be interested in that? Beautiful. You enter that. Perfect. You see somebody sluggish. They're getting a lot of colds. You start to ask them, great, hey, what do you eat? How often are you sleeping? And just understand where people are stuck in their health. You have full control of that. You have the potential, but now you just got to pull them towards you. And that is going to help you not just be a sports PT, but a healthcare provider. Good luck on your journey as you manage people and their health. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.